arthritis has patterns, and understanding them helps you know when it's time to explore your options. I'm Dr. Sean Liu, your friendly orthopedic surgeon. Arthritis doesn't worsen suddenly. It progresses through recognizable changes. You may feel stiffness that takes longer to ease in the morning, or swelling appearing after shorter distances of walking than before, or a deep ache that settles slower each week. Some people start avoiding slopes or stairs without even realizing it. That's the body adapting to increased joint loads. These signs don't mean surgery right away, but they do help us understand whether the joint is still coping or beginning to struggle. Early clarity can make a major difference. When we assess arthritis before it reaches advanced stages, recovery tends to feel smoother, pain is easier to control, and options remain broader. Waiting too long can lead to muscle compensation, stiffness, and increasing instability, making the path forward harder. If your knee is giving you these repeated signals, listening early helps you stay in control of your mobility. Let clarity guide your next step.